Pathophysiology of respiration. Multiple conditions can inhibit the body's ability to effectively provide oxygen to cells. Disruption, pulmonary ventilation, oxygenation, and respiration will have immediate effects on the body. Must be recognized and corrected immediately. Cyanosis, good tell, cap refills, another sign. Capillary refill, if you squeeze the finger and the color change is greater than, I want to say 5 seconds, can't remember, greater than 2 seconds. Important to distinguish a primary ventilation problem from the primary oxygenation or respiration problem. Also, cellular respiration is the same thing as internal respiration. External respiration is the same as pulmonary respiration. Look at this picture. There's not a lot to this picture. Every cell needs a constant supply of oxygen to survive. Some tissues more resilient than others. Sufficient levels of external respiration and perfusion are required. Perfusion is circulation of the blood within an organ or tissue in adequate amounts to meet the cell's current needs. More than 10 minutes, terrible. Brain damage. Cardiac irritability happens around 1 minute, and at 4 minutes, brain damage not likely, but at 6 minutes, brain damage is possible. 6 to 10, your brain is going. Oh no. Don't do that. Don't do that. It's alright. We'll make this work. Please come back. Hypoxia, dangerous condition in which tissues and cells did not receive enough oxygen. Death may occur. Nope. Yes. Death of cells may occur if not corrected. Onset degree of tissue damage often depends on the quality of ventilation. Early signs include restlessness.
That they're laced with cyanide.
What? Often, early signs of restlessness and irritability, apprehension, tachycardia. I'm getting a lot of stimulus at once here. Hold on, Phil. I will call you back. Responsive to patients' signs and mental status change. A weak 30 pulse and cyanosis. There we go. Weak 30 pulse and cyanosis. Come on. So we need to bring our cells back to life with oxygen. How do we do that? By providing supplemental oxygen as long as the patient is breathing. If the patient is not breathing, then we will ventilate for them through a bag valve mask, in which we squeeze the bag and ventilate. But we don't want to squeeze too fast. If we squeeze too fast, same concept of the cardiac output being decreased. If the heart beats too fast, the air isn't actually transferring and getting all the way to the alveoli, which means you're not really doing anything, or you're doing it inefficiently. One other point, also you're going to throw air into the gastric system, the stomach. And once you distend the stomach, that air's got to go somewhere, and it's probably going to shove whatever they had for lunch or dinner back out at you. Maintaining a patent airway is critical for provision of oxygen to tissues. Yes, open the airway. Intrinsic, internal, extrinsic, external. Intrinsic factors include infection, allergic reaction, unresponsiveness. The tongue is the most common obstruction in the unresponsive patient. Easily corrected. Can result in hypoxia and hinder tissue perfusion. Indicators: snoring, respirations, improper position or of head or neck, prompt the correction if necessary. Some factors that are not, well, that would probably help the audio quality. I'm not going back. Carbon dioxide in the respiratory and circulatory system is increased, depending on some medications. It can depress the central nervous system if taken in excess and lower respiratory rate and reduce tidal volume. This is what happens whenever some factors directly are a part of the respiratory system. Also, interruptions of the central and peripheral system can drastically affect breathing as well. This is the peripheral. Trauma to the head and spinal cord can interrupt nervous control of ventilation. Neuromuscular disorders can affect the nervous system's control of breathing. Examples: muscular dystrophy and poliomyelitis. Is that what polio is? Neuromuscular blocking agents, paralytics, paralyze a patient and induce apnea. Apnea is not breathing. So they are no longer breathing. We are breathing for them using rapid sequence induction, RSI. That is our bread and butter as paramedics. Allergic reaction. Swelling, angioedema, obstruct the airway. Bronchoconstriction can decrease pulmonary ventilation. Also associated with conditions such as COPD and asthma. Extrinsic factors can include trauma and foreign body airway obstruction. Fog. Trauma to the airway or chest requires immediate ventilation and intervention. Blunt or penetrating trauma and burns can disrupt airflow through the trachea into the lungs. Quickly results in oxygenation deficiencies. Trauma to the chest wall can result in structural damage to the thorax, leading to inadequate pulmonary ventilation. An example: a patient with numerous rib fractures or flail chest may purposely breathe shallowly in an attempt to alleviate pain from the injury. This is called respiratory splinting. Can result in decreased pulmonary ventilation. Proper ventilatory support is crucial in this. Hyperventilation occurs when carbon dioxide production exceeds carbon dioxide elimination. Carbon dioxide production can exceed the body's ability to eliminate it. Carbon dioxide elimination can be depressed at the extent that it is no longer keeping up with normal metabolism. Hyperventilation occurs when carbon dioxide elimination is needed and carbon dioxide production. Hypoventilation and hyperventilation could represent the body's attempt to compensate for various abnormal conditions. For example, if the pH of the blood is too high, you have alkalosis. It is too basic. The patient's breathing may become slow or shallow in an attempt to retain carbon dioxide to decrease the pH. Decrease in minute volume decreases carbon dioxide elimination. Increase in minute volume increases carbon dioxide elimination. This lowers the carbon dioxide in the blood, also known as hypocarbia. External factors. Adequate respirations require proper ventilation and oxygenation. External factors in the ambient air have a key role in the overall process of respiration. Examples: atmospheric pressure, partial pressure of oxygen. The high altitude percentage of oxygen remains the same, but the partial pressure decreases because of the atmospheric pressure. This is also why people in the Olympics go to the mountains to train, so that way their body's training by increasing red blood cell production. So when they go back to normal heights and sea level, they have a lot easier time doing work because their body is able to catch more of the oxygen in the air due to the high red blood cell count. But the off trade of this would be a more viscous blood that's more prone to clotting, and that's just through my own analysis. I haven't actually read that, and I'm waiting to read that, but I believe that's the case. Make proper oxygenation and respiration difficult. In particular, the cardiac output has a much greater affinity for hemoglobin than does oxygen, 250 times more, which is what makes it so dangerous in fires and why you don't turn on the generator inside of a house or turn the car on and shut the garage. Inhibits the proper transport of oxygen to tissues. Yes, that is what it does. Internal factors. Conditions that reduce the surface area of gas exchange also decrease the body's oxygen supply. Medical conditions may decrease the surface of alveoli by damaging them or by leading to an accumulation of fluid into the lungs. Non-functional alveoli inhibits diffusion of oxygen and carbon dioxide. So blood entering the lungs from the right side of the heart bypass the alveoli. This is called intrapulmonary shunting. Return to the left side of the heart in an unoxygenated state. So blood entering the lungs from the right side of the heart, this is where it starts, it's entering, bypasses the alveoli, returns to the left side of the heart in an unoxygenated state. So that's the whole point of it going to the lungs, is to obtain oxygen. This is called intrapulmonary shunting. Submersion victims and patients in pulmonary edema have fluid in the alveoli. It inhibits the adequate gas exchange at the alveolar membrane. This results in a decrease in oxygenation and respiration. Exposure to certain environments, conditions, or occupational hazards can also result in fluid accumulation in the alveoli over time. Examples, you have high altitudes, you have epoxy resins. These conditions can result in anaerobic respiration and increase in lactic acid accumulation, which creates life-threatening conditions. Other conditions that affect cells include oxygenation and glucose levels that decrease. The body is unable to meet metabolic needs and maintain homeostasis. So cell death is going to happen if they can't metabolize. You could also get infection. This increases the metabolic needs and disrupts homeostasis. This will lead to cell death if it is not created. Hormonal imbalances. If insulin level decreases, cellular uptake of glucose will decrease. Cells metabolize fatty acids, result is ketoacidosis, a form of metabolic acidosis. Circulatory compromise that leads to inadequate perfusion of oxygen demands will not be met if this is the case. Obstruction of blood flow to cells and tissues, typically related to trauma emergency, so including simple tension pneumothorax. Open pneumothorax, this is a sucking chest wound. If somebody took a bow and arrow to the chest and you pull it out, now you have a sucking chest wound. Air, this is me sucking. So air's coming in, going through all the bronchioles down to the alveoli and everything else where my lungs are, right? Well, what if I have a shortcut? There's a hole in my chest now. I'm sucking, well, air's coming in through here. Open pneumothorax. Hemothorax, blood, pneumothorax, pulmonary embolism, there's a block, pulmonary vein to the lungs, so there's a block in the blood getting to the lungs. Pulmonary embolism. These conditions inhibit gas exchange at the tissue level. Conditions such as heart failure and cardiac tamponade. I'm going to try to give my own input on these because we're kind of past the just reading the big words part. Cardiac tamponade inhibits the heart's ability to effectively pump oxygenated blood to the tissues. Blood loss and anemia reduces the oxygen carrying ability of the blood. Fell off my train of thought. Blood loss and anemia reduces oxygen. Yeah, so there is less red blood cells due to anemia. That's what anemia is. Not enough hemoglobin molecules available to bind with the oxygen. That's red blood cells as well. The body is in shock. Oxygen is not delivered to the cells efficiently, and you can also have hemorrhagic shock. So this is a form of hypovolemic shock. You're just losing blood. There's not enough blood in the body. Abnormal decrease in blood volume due to bleeding. If you cut someone's femoral artery, they're going to decompensate fast. Causes of inadequate oxygen delivery to the body. Inadequate. I guess it's killing the blood's clotting. Vasodilatory shock. This is caused by an increase in the size of the blood vessel. Diameter of the blood vessel increases. Blood oxygen decreases, and the blood flow diminishes. Oxygen is not delivered effectively to the tissues. Both forms of shock result in poor tissue perfusion that lead to anaerobic metabolism. If the shock is suspected, treat aggressively. Acid-base balance. Let's take a minute. Gather my